Hello, and welcome to The Leap. We are really glad you are here and want to thank you for joining us today. This is your podcast to guide you on how you too can make the leap from working for someone else to being in business for yourself full time. Before we dive in, remember you can find the audio podcast version of this episode and others on Apple Music, Spotify, and SoundCloud. Now let's begin. Here's your host and fellow leaper, Tim May.
Hello, this is Tim May, and welcome to The Leap. I've got a special guest in the building today. Y'all are in for a treat. Dr. Asena Madison, how are you?
I'm well. Thanks so much for having me, Tim. It's an honor to be here.
Oh my gosh, no, it's an honor to have you. My goodness. The Garden of Eden Health Center, Chesterfield, Virginia.
Amen to that.
Go ahead and say something about it. Go ahead and introduce yourself and what you do.
Well, my name is Dr. Asena Madison. I'm a primary care physician, and I found a passion with nutrition, lifestyle medicine, using nutrition to treat, prevent, and reverse diseases. So that's what I'm loving and doing at the Garden of Eden Health Center. We're on the south side of Chesterfield. And I still do the bread and butter primary care. So any medical problems, acute issues, high blood pressure, diabetes, or a sore throat, we take care of it. But we also get to do nutrition education and really get people to think about taking ownership of their life and their health. And that's what I'm passionate about, is educating people in that journey so that they're successful.
So the full package.
Full package, body, soul, and spirit. That's our motto.
So Garden of Eden, how'd you come up with that name?
It was definitely a God-given name. I was at a conference, the International Nutrition and Medicine Conference in D.C., I guess 2 years now, and they were talking about how to reverse diseases with plant-based diet, and I had never heard of this research, but when they were sharing it, it was just like, I knew it was true. I mean, there's no way that a body that's always being regenerated has to stay disease-stricken. And so they were just sharing research after research, and, the guy was like, it's in your own Bible, it's in Genesis. And I'm just like, let me go back and check it out. It's in Genesis 1:29 about eating what grows out of the ground off a tree. And so, it just felt like one of those Esther moments for such a time as this. And they're sharing, and I'm like, their practices are successful. I'm like, so y'all can take care of people, focus on this, and still be okay as a business. And I was like, well, if they can do it, I can do it. And just kind of walked and talked with God. And he was like, yeah, you can do it. And I was like, all right. And I'm like, when? He's like, yeah, now. And I'm like,
gosh.
You mean now is in now? And so I was like, so what do I call it? And he was like, the Garden of Eden Health Center. So it's about getting back to God's original design, body, soul, and spirit. And so, when you think about, biblically in Genesis, it says man was made in God's image and likeness, right? And so does God have any sickness or disease? Just in your imagination, he's not walking around overweight and having heart trouble. He's perfectly healthy. And so if that's who we're made after, then so should we be. And so your original design is with total health. And he gives man his original diet in Genesis 1:29. And he's like, eat what grows out of the ground off a tree. And that's what the research supported. And then, it's even better. They've got good relationships. Adam and Eve before the fall, they've got a great marriage. They're naked and unashamed. I mean, go ahead, married people, do your thing, right? So, and God walks with them in the cool of the day. So, that spiritual well-being and relationship with God is present. And so, that's a whole living right there. So that's kind of what you want to get to.
Okay. Wow. If you live in the greater Richmond area and you need a doctor, wow. Dr. Asena Madison is the one. Are you my mother's doctor? I think I was at my mom's house a month or two ago, and she said that you're now her doctor.
I can either confirm
God
or deny
bless
that.
you. God bless you. Ooh. Love you, Mom, because she's going to be watching this. And, she's making some changes. And it takes people some time and everything like that. But I see her health improving. And
excellent.
I want my mom around for a long time, right?
Yes,
and that's what life is about. Let's talk about your childhood. Let's go way back, all right?
Alrighty.
But even before I do that, so you are a doctor.
Yes.
And you own your own practice.
That's correct. I own my own practice. I opened up just last year in February. So I signed the lease in February, and we probably saw our first patient in March. So
it's so exciting. Oh my gosh. All right. Let's go to your childhood.
Okay.
Where are you from? Tell me a little bit about your childhood.
So I'm born and raised in St. Louis, Missouri, Midwest. And I'm the youngest of 6 children. My mom and dad are still both alive in St. Louis. They were actually separated my entire upbringing. So ever since I was 2, I've only remembered my mom raising us. So single parent home raising us, but we live with my grandmother. So we grew up on welfare. So we're not at the top of the line when it comes to finances. But one thing my mom emphasized was education. You know, you were going to make the best grades possible. You got rewarded. Like if you made straight A's, you got $10. Every A you got $1. If you got a B, 50 cents. C's and D's, nothing. You get a D or F, you get a whooping. So it's kind of like I learned real fast on this scheme of, I'd rather have $10. I'm going to try to make straight A's, you know. And so you shoot for the stars even when you're younger because you're getting that immediate reward. So parents use that to your advantage. So it was great. And when you're the youngest, you can kind of see everybody else doing their thing. So I'm very observant. We're about 2 years apart in general. And so my oldest brother, I'm 37, so he is 48.
Okay.
So that gives you a nice bandwidth. You know, you can see him go to college, make his mistakes, and he'll come back and share what to do, what not to do, how to be successful. And that kind of just kept setting me up to have more opportunities and to, you know, get a good idea of what life was kind of about before I got there.
So you are in what grade when the idea of becoming a doctor comes, or like when? When was that?
Yeah, that's a great question. So I was actually in 10th grade, and we had done an international, American Youth Foundation was an international conference that helped develop leaders. And, you know, when you're in high school, you never want to sit down and not talk, but they were like, take 30 minutes, sit down, no talking, and answer 2 questions. You know, what are you passionate about? What would you do even if you didn't get paid? And then the second was, how can you use that to make a difference? And so, you know, I'm sitting there thinking, I'm like, well, I'm fascinated with the human body. You know, I had been blessed to have, I love food. And ever since like elementary school, the first after school activity I remember going to was a math and science program, but it's just because they had popcorn. And I was like, I'm hungry. I want some. I'm showing up. They started doing experiments and I was hooked. And so it's just a nice trajectory that in middle school, all the best math and science programs, they always had food. So I kept coming. And so, you know, where there was food, there I was. And I was loving and just developing this passion for it. And so I love math and science, the human body. That was my thing. And I just thought, how can I make a difference? I hated unnecessary suffering. And so I was like, well, that combination, I could either be a doctor or a nurse. And I was like, what's the difference between the two? And I'm like, the doctor gets the final say. And I was like, I want the final say. You know, if it comes to someone I'm taking care of and I believe I have the best judgment, I didn't want to be in a position where I always had to be second to someone else's opinion. So I was like, I'll be a doctor. And from that point on, I just shot forward and just set my path. But I remember asking my mom if I said I wanted to be anything else before then. She was like, no, you never said what you wanted to be. Now, in my mind, I think I at least wanted to be an astronaut once. But it was definitely solidified in that between 9th and 10th grade year.
So you are going through your high school career and you're starting to look at colleges. Where did you go to school?
I attended the Washington University in St. Louis.
Wow, tough academic school.
Yeah, you know, it was what we call the Harvard of the Midwest. Yeah. And because I went to a predominantly Black high school and it was challenging. We were in the suburbs, but really so close to the city, you could reap both benefits. But my high school, I went to Normandy High School, and they always questioned our caliber coming from there. So I was actually valedictorian. Okay. So, you know, that just comes from your mom being like, she'd come up to the school if I had an issue. I got lots of whoopings growing up. So leadership started in elementary school. My teacher realized if I was acting up, the class would act up. If I acted right, they would act right. Wow. And so thus the whippings began. Wow. And I had to learn real fast that leadership is positive or negative. And I was tired of getting whippings and I was like, so I'm going to get my act together.
So you go to this amazing university.
Yeah. And I knew they were preparing people for medical school. And so since I knew I wanted to be a doctor, I wanted to be sure I came from a school that the credibility, if I did well there, it meant I could do well anywhere. And so thankfully I was on scholarship. God bless that I went full ride. I mean, I had so much scholarship money, they had to take some back.
Wow.
Yeah.
Wow.
So like high school seniors, you're out there, apply for everything. You know, if it's $500, $1,000, I apply for it. You know, it's like if you're Black, that's me. I'm applying for it. If your parents are poor, it's a great time to not have a lot of money when you're applying for college, because then you get grants. And, just if you worked hard, it was definitely a time to be rewarded. And so I thank God for that opportunity.
And there are people out there that are looking to help people who need the help.
Yeah, I even got a Gates Millennium Scholarship.
What?
Yeah, Gates Millennium. Yeah, so.
You were a Gates Scholar?
I'm a Gates Scholar.
Wow, okay.
So, thank you, Bill Gates. Bill and
for
Melinda.
sure.
Yeah.
Someone who had a dream, built a business, defied the odds, and is able to help a lot of people.
That's exactly right. And so I'm grateful for those who know to look back and support the next generations.
So you're in college and you're on this path. And where'd you go to medical school?
I went to VCU School of Medicine. So it was called Medical College of Virginia back then.
Okay.
And I was deciding between that school and another, but I ended up doing a 1-year graduate program. And so that's how I came to Virginia. And I thought I was going to be here 1 year because what's in Virginia?
Oh, yeah. Okay.
But once I got here, I realized the people at the medical school treated you like family. And so I knew if I was going to a rigorous academic institution like medical school, I needed a family type of support. And so they gave me that. And I had a church family at Mount Gilead, and that was very supportive. I was a part of the Christian Medical Dental Association in Richmond. That was very supportive. So I knew I was going to have these social supports in place to help me with during a very difficult time.
Which is crucial.
It's so crucial.
I mean, people can think that they can do it on their own. And my question is why? I mean, it's learning can be right outside the way you think. And when you're exposed to different things and your mind grows, it can open up opportunities for us. Okay, so you're in medical school. Talk to us about that.
Yeah. I remember getting some really good advice from an upper level. And he said, medical school is a marathon. So don't try and sprint. And so you can get on this roller coaster of like binging to the next exam, then crashing, and then, and so that's not sustainable. And so he was like, just run it like a marathon. And I remember thinking, okay, like a marathon. And so, it was definitely challenging. It's not easy, but when I'll go back to college because college, I graduated valedictorian from high school. So I'm used to, doing stellar, like getting A's.
Yep.
And then I go into that first year of college and I'm not getting A's. Like I got a C. And then the next test, I got a D. And I was just like, I studied more. How do you get a D? Yep. And so I barely made it through the test without crying and just being wiped out. And I remember going to sit on the bleachers after the test. And I was just like, okay, God, like, I never asked you if I should be a doctor. I was like, I just thought, I just put it together, just had that discussion. But I was like, no doctor is failing general chemistry. Like you can't go and be a doctor if you can't pass chemistry. And so I was like, hey, I don't care what I do. I just want to be successful at something. And so I cried it out. And then I remember going to church one time, not paying attention to the service. And I was like, okay, God, should I become a doctor? And just talking in my head. And then the minister is like, yes, like really exuberant. And I'm just like, is he answering me? Like, I really wasn't sure what I was expecting. Like, you're supposed to hear God in your head or something, like otherwise. But I wasn't really a professional at hearing from God. So I was like, okay, not sure if that one was for me. So God, I'm going to ask you one more time. Do you want me to be a doctor? And then the minister was exuberant. He was like, yes. And I was like, all right.
There you go.
I'm going to take it and run. And so what I realized is I was supposed to be a doctor. I just didn't know how to study. And so sometimes when you're not doing well in school, like you have to learn to think a different way in college. And I never had to think that way. I mean, I could either memorize it or cram it in and pass the test, but for a longevity pattern, with your health, you don't want me cramming that in. Right. You need me to understand it, synthesize it, put it together, think critically, and then execute a plan. So I just needed to learn how to think. And thank God for good mentors. Like Dr. Harvey Fields was a great mentor during that time for me. He was actually a pastor and getting his PhD in chemistry. So It was a win-win scenario. So I wasn't doing that journey alone either. I had good support. So he helped me with the academic part as well as the emotional support part as you're going through something, all those challenges.
So you graduate from medical school and then what?
Then I went to residency at Chesterfield Family Practice. So that's right on the south side of Richmond as well. Dr. James Anderson was my mentor there. So he's my attending.
Shout out to Dr. Anderson, longtime family friend.
Yeah, amazing. They call him the evangelist in the white coat.
Absolutely. And everybody in Richmond, Virginia knows him.
Yeah. I mean, he's such a pillar of wisdom and just a genuine love for people. And so, that's the kind of person you want to follow. And he would offer to pray with his patients at the end of the visits. And it was just a wonderful thing. And his patients loved it. Like if he tried to leave out the room because he was trying to get to the next patient, he didn't pray, they would say, you forgot to pray with me. Like, come back and let's finish this properly. And so I just remember being like, I'm going to offer that to my patients. Like, that's a wonderful kind of spiritual impact to go with the natural that you're working with. So I took that nugget from him, and that was a 3-year journey, and graduated from there. And, took a couple months to take a reprieve because, once you start working in medicine, there are no real vacations after that. So I took 3 months off, and I was like, I'm not working for anybody. Like, I'm just going to take a break. And then I, did some locums work. And so that was great because it was a faith-based organization. And so I enjoyed that. And then once I learned about corporate medicine, that's where I began to think about it challenged me into thinking, maybe you won't be able to just be a doctor where you just take care of people. Like there's somebody else influencing your time, your schedule, how long you can take with a patient.
Yeah.
And you start to think about, when are we compromising care over quality, and where's all this money going that we're trying to make anyway? Like at what point do I get to say it's enough and I just want to take good care of my patients? And so that's when it got to thinking about that entrepreneurial, I might have to do this in medicine too, or this is just not working. All I knew was this is not working anymore. And so I was just ready for any reason to leave. So when it came, I did.
Wow. Dr. Asena Madison, the Garden of Eden Health Center in Chesterfield, Virginia. Oh my gosh. If you're looking for a doctor, looking for a doctor. She is not paying me to say this. I'm seriously. If you could just feel, if you're listening, if you're watching this, if you can just hear her spirit, feel her spirit, you want a medical professional with her spirit to take care of you. It's beyond, you go into a doctor's office, and I think a lot of us have felt this. You go into a doctor's office and they're in a rush. They get to you, they're rushing. And it's almost as if they're even battling this. I know I'm a doctor. I know I need to be helping this person, but I've got 4.5 to 7 minutes with this person before I've got to get to the next appointment. Mm-hmm. And to no fault of their own, the system is the way it is. And it just is not a good feeling. Mm-hmm. And, America, the health system, it's got its challenges. You're figuring some things out, though, and you're doing some things different. We'll get into that in a moment, but walk me through the moment that you were like, you know what, this is not the way it should be. I need to do it differently and have my own practice.
I had some colleagues who were 60 plus, and they're just loads of wisdom. And so at some point when you're trying to work through the proper chain of command and it keeps coming back as this shut door, and you realize they're not listening, like your voice is not heard. And when you realize that even as a physician, it's a career where people think, oh, you've got job security. And then something happens and you realize I'm expendable to this system. And that is a very interesting feeling to say when you realize somebody doesn't value all that you bring to the table. And I think when you work so hard and you have that kind of entrepreneurial spirit, you kind of have I don't have to take this. You're not really sure. I wasn't really sure where that was going. Because if you had asked me any given day, do I want to start my own practice? The answer was always no, I do not. I just want to take care of people. And I didn't want to be bothered with insurance companies and that whole world. I just wanted to take care of people and just have my encounter and do that well. And I knew it was a whole monster load if you go and open your own practice as a doctor. And so they don't even train us in medical school on how to run a practice or the business of medicine. So that's something we've been challenging is doctors shouldn't come out of medical school without being trained on the business of medicine. So, and
And
which
you
means
know what?
systemically they set you up to always work for somebody else.
Same
Sorry,
thing with the
I
same thing
screwed
with the
on the
business
bus.
school. You go into the business school, and maybe some schools are different. You go into the business school and you learn different functions, but you don't actually learn how to actually own a business.
Mm-hmm.
It's like, but it's business.
Mm-hmm.
And I went to University of Richmond, and my first 2 years, I was always an entrepreneur-minded person. My first 2 years, wasn't the greatest student, but it was because I was bored. It was like, when are they going to start talking about actually, it's a business school, when are they going to actually start talking about owning a business? And it never came.
Really?
It literally never came. And after 2.5 years, it was an agreed upon conversation between the associate dean and myself that if I was going to graduate in 4 years, I would have to go find another major. And since they weren't teaching you how to own a business anyways, I said, okay, I'll major in something else. And, I own a business anyways.
Yeah.
But it's just interesting how they don't even in medical school or other professions, they don't teach you how to own it.
Yeah. And it's different because, we're in different waves because people who are probably in their 60s now, when they came out of medical school, that's what they did. They went out, hung their shingle, and they owned their own business, And now we went through a wave of hospital groups starting to buy the small private practices. And so that's how they're building now. And, it's a different model. And so, but, when you're learning grassroots, there's a whole lot of learning mistakes that you're making because you haven't been trained on really how to do this.
So you make the decision and walk us through that process of decision to actually opening up on the first day.
Yeah. So when I had my come to Jesus, you're going to open this up now. I was working somewhere else. So I had to give them, as a doctor, you have to give like a 3-month notice.
Wow.
So,
wow.
Yeah. So, I was like, okay. At first I had to make sure I was hearing from God because, you feel like, is that really real? And then who's going to help me out? And so some names started dropping in and I was like, okay. And so I gave my notice and I was like, okay, well, practically I was like, I don't want to be here at Christmas time. So I'm at least going to stop before Christmas so that I can start the next year fresh, have some time to think about it. And I started to kind of think through what should I be doing now. I started to talk to another business owner who it was actually a nurse practitioner who was known to kind of help other doctors start their practice. And what's great is that guy was leading her, like putting me on her heart. And she was like, I've been thinking about you. Yeah. And so that was just a great connection. And so she's been helping me walk through kind of what you do on the back end. And you got to start the insurance process before you open the doors, actually.
Yep.
So, she was helping me with that, getting your organization, incorporated. And, you got to talk to lawyers because you need to figure out how should this be set up? I need to set this up right. You've got to think about malpractice. So a lot of litigious things. So you've got to consult with other people that you probably have never had to talk to before. So lawyers who know about medicine and accountants who know about medicine. And
you got there by asking questions and because you don't know what you don't know.
I just had to keep asking. All I knew is you don't want to get sued. And you need all these things in place. And if you've never done it, you've got to ask to get those resources. And so I just kept asking.
Let's take a moment on this point. Because there are people watching this and listening, and they don't know how to navigate.
Mm-hmm.
The power is in the questions. When you can just ask one question, get the answer, then ask another question, and then that takes you on the next kind of maybe 2 more steps. The power is in the question.
Mm-hmm.
Because like you said, you didn't know necessarily like where it was going to happen or how it was going to happen. But being resourceful is what business ownership is.
Yes.
And so you found someone and you asked them and they knew somebody and they knew something and that led you to the next thing.
Yep.
And so, the turn of the year, talk to me about leading up to you open up the doors.
So the person I talked to, we're actually trying to find a location. And so I'm looking for different locations, going to check out spaces. Do you want to build out or not? And how much is that going to cost? And considering I had just figured this out 3 months ago, it's not like I had set this capital to the side where I'm like, I've been planning on my life for this moment.
Yep,
so
right,
it was pretty much, okay, I'm about to go into my own 401k and invest in myself. And so all the money that goes there, you're looking at setting this up. Thankfully, we found a really good spot, and it was already built out for a clinical space. So that was wonderful. And thank God the owner, actually the builder, is the one who leases the location as well. So, and he's a believer.
Okay.
And which means we talked about it, we shook hands on it, and that was that.
Wow.
Because he said the next day somebody called him who was willing to pay full price, and he was giving me a starter discount. And I was just like, thank you, God, for this man having integrity to say, because I told you verbally that we would do it, I'll honor that. And so that was very favorable. So I had a location. And once I was, I had it's a P Corp, professional corporation. So that's how it's structured. I had to decide which kind of electronic health record to get. So I consulted with some other docs. And actually, before I left, I was up in Baltimore. Before I left Baltimore, I went to Delaware to follow a doctor who was doing nutrition and medicine, kind of lifestyle medicine, and learning the ropes. Like, I was like, I want to see somebody who's doing this. And I'm a visual learner. I'm kind of like, I want to see it, touch it, be around it. Because if I can see you do it, then I have that assurance, okay, I can do this. And so I wanted to see somebody living and acting and doing it out. And he was like, yeah, sure, anytime you want to come up there. And so I did. I drove right on up there. Shout out him for the day. And he's been a great resource. I could just call and ask for different information. So definitely a blessing there. So
Dr. Madison, you said it. I mean, the essence of this, the essence of this podcast is if they can do it, I can do it.
Mm-hmm.
It's the seeing it, the hearing it, the connections that may be made, because it just, when you see life in somebody else and them living their dreams, it can kind of almost give someone a spark.
Yeah.
And someone's listening to this, and at first when they were first listening, they heard doctor, and they're like, well, I'm not a doctor, but they kept watching, right? And they're listening to this, right? And 2, 3, 5, 10 minutes in, they're like, wait a minute. If she can do it, I can do it. And it might not be to become a doctor, own a practice. It could be whatever it is. Because there's struggles and there's hurdles to overcome no matter what.
Yeah.
But you hit on it. It's like, if it's in here. I can figure it out and be a problem solver. What's one of the hurdles, or what's one of the things that has been challenging that leading up to opening up your practice? And then we'll kind of get into your story of opening up the door.
Yeah. So when the doctor I shadowed was Dr. David Donahue, and I remember him telling me to the effect of, you're going to have to always be hiring and always almost firing. So like, he was like, that just comes at the territory. Yeah. And I'm kind of a softie, surprisingly, I don't want to fire anybody. You know, you hope people are like you and that they'll have good work ethic.
And by the way, don't forget your thought, but by the way, it is harder. This is my personal opinion. It is harder for an owner of a company to fire somebody than when you're in corporate America and you are an employee of the company.
Yes.
It's not your company and you have to fire somebody.
Yes.
It's gut wrenching. It's gut wrenching. But anyways.
Because you're thinking about their life, their family, how are they going to survive after this? Yeah. I mean, I'm in human resources. Like, I care about people's lives. And so when you're changing something about a person's life that big, you're just like, is there another way?
Yeah.
And you keep trying to figure out this other way, and it's just not working for your business. And so you have to make that decision and say, wow, I do have to let you go. And that has probably been the toughest one of the toughest things, because it's like, oh, that's real.
Oh my gosh. I don't know when the audience is listening to this, based on the timing, but it's 2020 at the time of us recording this. And, there's been some sickness with, the COVID-19 and things like that. And with my company and having to, lay people off, I literally had to call my mentor and ask him how to lay somebody off. Like, I knew the words to say, but like, how do you actually do it? And, I'm getting emotional right now. You have to he walked me through it. And then, so I called the first person, and it's like the first person I've ever hired, right? So it's extra and I am crying. She's consoling me. She's consoling me. Tim, it's going to be okay. Because they're family, right?
You build relationship. Yeah.
It's tough. It's tough. So you walk us through the night before you open up the doors for the first time. I don't want to hear about it.
The funny thing is the person counseling me, I wanted to have all these things perfect. So even though I haven't been planning this for years, I kind of was like, it's got to be perfect. And she was like, no, just open the door. She's like, you don't need anybody else. You can check them in, you can see them, you can treat them, and you can send them out.
Yeah.
And it was like, you're right. In your mind, I'm used to this big structure where there's a front desk and there's all these people working. You've got nurses and you've got people answering the phones. And so, this mega, the big growth.
Sure.
But now it's just like, it's you. And you realize, okay, I'm well labeled. You're right, And I did it, and I had my first patient, and she thought it went fine, and she keeps coming back. Like she's still my patient to this day. And so I messed up all kind of stuff. I hadn't put her insurance in right,
and they don't know.
And she was like, it's okay. And so the good thing about taking care of people who you're okay with being transparent with them, and just, it's like you're doing life with them in a sense.
Yeah.
They're also gracious to you.
Yeah.
And so I appreciate that from my patients.
That's a huge lesson. Because when you are in corporate America, there's so much about trying to be impressive.
Yes.
You have the spirit of being impressive because you want to be noticed so that you can get that raise or that promotion. And when you own your own business, it's almost a humbling spirit that you have to have. Because now it's a spirit of truly serving people. And you're right. Like people, they love you for that, right? And man, we're getting a lot of nuggets. Y'all are getting a lot of value out of this. I got some more questions. I want to keep rolling. You got a little more time? So that's day one. Talk about one of the blessings, like, what is something that you're able to do because you are your own boss and you own your own practice that you maybe were not able to do when you were working for somebody else?
Yeah. So in college, I realized, how you can make your own schedule in college? I realized I didn't want to have my first class till 10 o'clock.
Not an early riser?
Actually, I like waking up early, but not to serve others.
But
to love on myself, right? So I need to get a workout in. I need to edify myself spiritually. I should have breakfast, and then I should be ready to go serve. Maybe knock out something on my own to-do list, because when you work 8 to 5, 5 days a week, when are you going to do the things that are only open from 8 to 5?
True.
It's just kind of like, DMV is not going to open for you on the weekend if they're not open on the weekend.
Exactly.
And so, you don't think about that until you're in the situation where your time is obligated.
Yep.
And so I was like, I would love to start my day at 10. And so really, I actually started at 9 because I just, in your mind, you feel this pressure to perform. And then COVID hit. And I was like, we need to shorten the hours anyway to make it more effective. And so it started at 10. And I'm like, I'm not changing that. I've been looking to start my schedule at 10 since I was in college.
Yep.
And now that I'm doing it, I'm just going to thank God and keep
when
it
you
moving.
were working for another doctor's office or offices, you started at what time did you have to be at work?
8. I had to start by 8, and you need to show up by 7:30 to see the 8 o'clock because you got to prepare. And so even though I started the first patient at 10, I'm there by 9:30 so we can huddle and prepare for the day so it runs smoother. And so that's been my latest joy is to say I can finally start at 10.
It is a beautiful, folks. I'm telling you, business ownership is a sleep-in person's dream.
It is.
And I mean, I live on the East Coast, but I was born in Los Angeles.
Okay.
And so I tell people 37 years later, I'm still on West Coast time. My body is still on West Coast time. So that early morning to start working, that doesn't flow. Oh my gosh, senior year in college, those 8:15s, I didn't really make too many of those, just a little too early. A little too early. So when you're on your own boss, oh my gosh, it's the Sunday evening gut check, like, oh my gosh, I got to show up tomorrow morning, and that feeling. And when you're on your own business, it's like, just don't have that.
Mm-hmm. And when you're on your own business, if you have that, I don't want to show up, it's on you. Like, what have you done with what you're doing that you have that feeling? And usually it means there's something that you need to confront that you haven't. At least for me, that's what it is. It's like, that's because you haven't confronted this issue. If you just clear that issue up, because I'm doing what I love. I'm doing what I'm passionate about. And so that's that God-given, it gives you the drive to do it because you just love it. It's not even on your mental radar. It's just you do it and you're like, this is a great day. I was born for this.
Yes, joy.
Joy, yeah. And so it's so important to encourage people. Like, I know people are listening in different areas, but what you're passionate about is so much attached to your career choice. And so don't let people tell you need to do something that you'll get paid for. If you do what you're passionate for and you do it well, people will pay you for it.
Living witness.
And so it's so much more. And there's so much enjoyment in life. And so don't settle for the lie of just doing something to get paid. That's such a lie. And then you almost aren't the best worker. How many people have you encountered and they were not passionate about that job? You almost wish they didn't come to work that day because their attitude is so stank. And so you just kind of need to say, be where you're purposed to be, and you would enjoy being there. And for every person that's not being the owner, I mean, there's some great people who are just, and thank God for them. Otherwise, there would be no businesses that run. Everybody cannot be the visionary. Somebody's got to manage it and make it work.
Shout out to my employees. Love y'all.
Amen to that. So I'm grateful for my nurses because it doesn't work well without them. It's so much easier with them. And so, do it.
Dr. Madison, where can they find you?
So you can find me online at Garden of Eden, RVA. So that's GARDEN of OFEDEN. Am I saying right? RVA.com. And we're also on Facebook with the same name, Garden of Eden, RVA. But we're located at 9549 Amberdale Drive in Chesterfield, Virginia. So if it's in the village of Amberley, people in that area, they know where the Sheets is. So we're by the Sheets.
Okay. And we'll make sure we put the address and all the contact information in the description part.
Yeah. And it's not too far from downtown. So it's about 15 minutes from downtown Richmond. You just, take the toll roads and you'll be at us. So don't feel like it's too far. We have people that come from Amelia, Petersburg, Fredericksburg.
Of course they do.
I'm amazed. And so I'm grateful for that.
But of course they do, because people they can feel your spirit, and then when you do a good job, people tell other people. Mm-hmm. People, there are companies that pump so much money into marketing and advertising that has its place, but there is no better marketing advertising than somebody saying, you know what, I just changed doctors to Dr. Madison in Chesterfield, Virginia. She is amazing. Oh, really? I mean, that's priceless, right?
Mm-hmm. Yeah. That is what we do most, is to say, hey, if you appreciated this encounter, as a thank you, share with 3 friends. And so that's been how we've been growing mostly. And
do you do what Dr. James Anderson does sometimes and pray with your patients?
Yeah, I always offer it, and we're very respectful and say, would it be helpful if I pray with you? And some say no, or some say in your personal time, and some say, I've never had a doctor ask me that. And they love it. And so it's a great way to capture and end that moment.
Dr. Asena Madison, the Garden of Eden Health Center. I enjoyed it.
Thank you so much.
Thank you for spending time with us.
Be in health, everybody.
Yeah. This is Tim May with The Leap.
If you enjoyed this episode, be sure to subscribe so you are notified when a new episode is posted. Rate and review this podcast and share it with your friends who you know would also love to take the leap. Thanks so much for listening, and I hope you are leaving with some great things that can help you on your pathway to full-time business ownership. Now go out there and put one foot in front of the other. Until next time.